So this is the ukulele, and because it's an NFT conference, it's also a total rug pull. I'm not going to play this in any way, shape, or form. I'm just taunting you with it.
So we're not going to rap?
We're not going to rap. We're going to rap in the way adults awkwardly talk to young people. Can we rap about that in the 90s? So I'm Dr. Owen Muir. I am a child, adolescent, adult psychiatrist. Next to me is... ta-da.
So I'm Dr. Carlene Macmillan, also a child, adolescent, and adult psychiatrist.
I'm Dr. Lisa Cortez, a psychotherapist.
And the coffee back there is very delicious, but you should be quieter when getting it. So we're here to talk about what's happened in mental health in Web3 and what could be happening. And the tail end of the last conversation, the question was asked, well, what's next? What's beyond involving not-for-profits and charities? And that is actually the thing that got at least Carlene and I, who, by the way, are married, so when she rips on me, you'll know why, interested in this space in the first place. Do you want to talk, Carlene, a little bit about how we got here and go from there?
Sure. So I think like many in the space, we first found out about NFTs on Clubhouse. My handle on there is @psychiatrist. So Owen and I, in its heyday, did a ton of talks on there, psychoeducational talks. And one day, someone messaged me and said they were going to airdrop me a blazed cat. I had no idea what they were talking about. So Blazed Cats is a project where 100% of the secondary sales go to Mental Health America. And at this point have raised, I think, over like $320,000. And so this got me turned on to the idea that NFTs could do good, and in particular could further things that I cared about, which was mental health. So I got involved helping to promote that project. And then, sure enough, people would kind of come out of the woodwork and say, hey, I have a project that has a mental health element. Can you help me? Can you advise me on it? And can you, speak on behalf of it? So, an early example of that is the Lost Boy project, which combines music and mental health. I became the psychiatrist in residence and did some talks, and they have peer support, and I think that's great. And there's many other examples of projects since then that either have this sort of peer support or coaching element. Maybe they have a mental health channel on the Discord, or maybe they're raising money for a cause like Mental Health America. But I think what we've become most interested in is how can we provide kind of actual mental health support to these communities. And that's an area where, like if somebody in a community is having a crisis, and somebody in one of these NFT communities is suicidal, psychotic, manic, the community doesn't really know what to do, right? There's only so much you can kind of do through the DMs. So in these circumstances, oftentimes I'll get pinged, or Owen will get pinged, and we can see if we can help that person. But there's not a lot of us, right? We can only help so many people one-on-one. So I think we're very interested in how can we build out networks of mental health clinicians that can help on a larger scale when there's actually kind of real crises, because these projects, they can only kind of go so far without that professional overlay.
Yeah. So just like you, I started with helping other projects. My Twitter, Lemny is here. She's joining us.
Yeah.
You want to introduce yourself before I start? Sure.
We'll pull to refresh so you're in the right order.
ATR.
You need to rap. We all did a little song and dance. No,
There
I'm kidding.
Dog and pony dance. Hi, everyone. Good morning. Happy Wednesday. Okay, I'm Lemny. I'm a trained clinical psychologist with about 25 years of boots-on-the-ground experience, working mostly in community mental health, correctional psychology, as well as working internationally abroad. Previously, before coming into NFTs, I was a director of behavioral health at a federally qualified health center in West Oakland, California. NFT artist with about 85 NFTs sold. Also a collector, NFT coach at the Dream Conduit, which is a nonprofit, first of its kind. We're all first of our kinds. Nonprofit DAO. And so what I do there is I do coaching and teaching folks about psychoeducation regarding mental health in the space and making sure that we're taking care of ourselves. In addition to that, I'm a curator at NFT.tips for the curatorial team Searchlight. And so that's me in a nutshell. It's a pleasure to be here. Community lead on a couple different projects in the space. So happy to be here, and thank you for having me. And sorry I was late. Yeah. Oh, I get to keep
You get
this
to
one.
keep it.
Okay.
It's your own.
So I started with helping other projects. My Twitter handle is the Anxiety Doctor. So obviously a lot of projects contacted me to help them with their projects, with their mental health spaces. And I was happy and eager to help them. And that just kind of sparked my passion to bring mental health to everyone around the world. I do have a project called Moody Mink Society, and that's a project that is bringing mental health to the metaverse. We're creating a meditation center called the Meditation Center, and we're also bringing mental health to schools all over the U.S. I think it's important for us to teach children at an early age to take care of their mind, and I think we can spread awareness, and that's really, really important. But I think teaching people to take care of their mind is super important. We teach children how to take care of their physical health with physical education in schools, but we always exclude the mind, and to me that's crazy that we still do that. So, just teaching teachers, training them to include these mindfulness techniques into the classroom, I think is really, really important. It's a step in the right direction to bring mental health to all, and that's what we're doing with Moody Mink Society. It's very, very important for me. It's my passion project, and I'm committed to bringing that to every child in the U.S. And hopefully globally, because I think it's really, really important. So that's what I'm doing in the NFT world. I'm still helping a lot of projects with their mental health spaces. I truly enjoy that. And I think we're all in this to bring more affordable, accessible mental health to all. I'm hoping that we can all inspire more mental health professionals, because there's only a few of us and it's much needed. So I'm happy to be here. If anyone resonates, you can follow me, Moody Mink NFT. That's my project, and then the Anxiety Doctor is my Twitter handle.
And by the way, if you have burning questions in the audience, we can't take those questions. So if you're going to raise a hand, please do. The thing that I've become obsessed with is essentially the utility of getting people access to help that's helpful and hopefully accessible. So the Silo NFT project is one that I advised both around their mission of contributing to MAPS, which is the bringing, among other things, MDMA to market as a treatment for PTSD. And the other thing we did with that project is bring a cost-plus pharmacy product, a drug discount card that means anyone who got that NFT can use that secondary mint to go to Rite Aid, CVS, et cetera, and get any medication for only $2 more than the pharmacy paid. And so, yeah, right? That's actual utility, so people can get actual medical care of any kind, it turns out, not just mental health. But that stuff is expensive. Pharmacies mark it up like $300 or more per prescription, and it's utter insanity. And the ability to get that out to the world with an NFT project turned out to be a hell of a lot easier than any other method of doing it, which, surprising, but that's what happened. And so I'm curious for the panel, when we go, past, okay, we're going to support a charity, and we're going to actually try to bring actual care to our communities, right? Community mental health, these are communities by definition. What are the roadblocks and opportunities that our panelists see? And we can start with Lemny, welcome, because you've done so much of it.
So I think that one of the things, obviously, is community, and that in and of itself is really a resilient factor for all of us. The fact that we can come together in situations like this, particularly during a pandemic, in times when everything has been turned upside down, and are able to come in together and work towards Web3 and work towards a project and an enterprise of this sort, really has been, gosh, how do I say this? It really has been a bed, gosh, what's the word I'm looking for right now? It's a net. It's been a safety net for all of us, each other, essentially. being able to kind of get together with people who are like-minded, who are interested in not only technology, crypto, finance, art, et cetera, mental health. These things bringing us together really has been a factor in supporting us to navigate these waters, particularly when the stocks go down, when the market crashes. What do we have as each other? And not just that, I think particularly for those who are the creatives, really have this opportunity to have community with each other and to lean on one another in terms of having a space and a support system to be able to kind of like share artwork and to share, a vehicle in a way with which we can really, metabolize those traumas that we're collectively experiencing together as a humanity. Is something that's really been important that I've noticed that has been really a factor that has been really just a resiliency factor for us collectively as a people. So I'm curious about y'all. What have you been seeing?
Yeah, I'm curious on the maybe the other side of that, Dr. Cortez. What's getting in the way of actual care? Because I mean, I've done a gazillion hours that start with
insurance
this
companies.
is not medical
Money.
advice. We're all in New York, and I'm licensed here, so I could theoretically provide care here, but not on Twitter Spaces. So help us understand those barriers as you see them.
So I love the title of this panel, Mental Health Off the Couch. And I think NFTs are going to revolutionize and help eliminate those barriers that we see. For my community, Latina, Latinos don't talk about mental health. The barriers was even just educating my community. And, I think with NFTs and Twitter Spaces, I think it's helping me educate my community, and I think that was one of the barriers that I saw when I first started practicing. But there is the barriers of now with Twitter Spaces, I'm licensed in Texas, and I can't really help anyone outside of Texas. To me, that's crazy still. I know why we have those regulations, but, it's hard.
Yeah, I think that's a big issue. So a lot of people say, I want to build a mental health center in the metaverse, and that sounds lovely. It's quite complicated to do that. I think we can do that, but that's going to take an international, not even just like state by state licensure. It's going to take international. So when you look at a larger Discord, they'll make sure to hire moderators from all different time zones, parts of the whole world, because if you have something going down at 2 a.m. your time, you need to make sure someone's there. I think the same is going to be true for anyone that wants to do anything serious and substantial in Web3 with mental health. You're going to have to really think, how is this going to serve an international audience, right? Even the drug card, which is amazing for the United States, isn't going to be a utility for people outside the United States. And so we really, I think, need to kind of come together internationally and get people from the more academic mental health and medical community to not be afraid of NFTs. And so, like, my Twitter persona, my LinkedIn, I don't have a separate one, right? A lot of people have this separate, NFT one. I don't. I make a point to have it be the same one and make it relatable to, both audiences. And I love being able to kind of bridge that gap. I think psychedelic medicine, so Owen mentioned Silo NFT, we have Psychedelics Anonymous. There's such interest in both the mental health field and in the NFT space on psychedelics, and particularly how they could be used for mental health, that I see that as a real opportunity to bring these worlds together. I can go to my day job and say, hey, I'm doing this NFT thing, it relates to psychedelic medicine, and they're like, tell me more, right? And so I think when we see those areas of commonality, that's where we can bring people more into the space.
And practically, if you're looking at crypto and NFT space as an actuary, the kinds of people who determine what risks are over the long term in the health of populations, it looks pretty good. On average, people are young and healthy, and psychiatric illness is probably the primary problem that people who are drawn to a space with so much novelty and excitement are going to have. But they're not going to have kidney failure, and so I think there's a real opportunity to both provide access to excellent mental health care and at the same time kind of reap the benefits of the fact that, you know, it's gonna be a while, and even longer if we do a good job of keeping people healthy. And that drops costs for the healthcare system in places like the US where it doesn't make sense, and places where it does make sense, like everywhere else on Earth. But it does seem slightly crazy that the more conscientious the professional, the less likely they are to have an easy time engaging. Because the more worried you are about liability, the less likely you are to dip your toe in. And at the same time, those are the people who are probably going to be the most serious about doing a good job in the first place.
Yeah.
And so there's that middle ground for people like us who have maybe the artist crossover that lets us more easily transition. Lemny, I'm curious what you'd say.
Sure. No, I was curious, Dr. Cortez, what are you seeing in Twitter Spaces? What are some presentations that people are coming up with, and you know, what are some maybe some skill sets or some tips that people can take home? You know, because we're all here together in the space. We all know that time and space does not exist when you have a global community. You know, and so what's the impact of that for each of us individually, and how can we collectively, you know, heal and move forward together in a healthy way?
Sleep. I think
Sleep.
Yes.
much needed.
Sleep to earn.
And it's something that's overlooked, and it doesn't only affect your mental health, but your physical health as well. It's such an amazing, simple thing that we can do, right? But we're all staying up on Twitter Spaces and emerging in this, you know, community, and we want to make sure that we don't FOMO and we don't have, you know, we're not missing out on anything. But sleep, I think just prioritizing sleep, exercise, and some kind of mental, you know, just breathing alone, just sitting down and mindfully breathing is such a powerful, simple skill that we can implement. And I think that's what's, you know, very basic, simple things that we can do that is much needed in this space.
We have about 6+ minutes left. If there are burning questions in the audience, please feel free.
If you
yes,
want-
good sir. And we have another after you, just so you know.
Okay, great. No, I thought it was really interesting to hear how, because you two, Owen and Carlene, are licensed in New York and Texas, you can't really help people outside of that. And I think one of the themes that I've seen in Web3 is just kind of the breaking down of borders and location, right? And theoretically, you should be able to help people who are in another state or in another country. So I think what would be interesting, and you know, this is for Web3 in general, is there seems to be an opportunity to update a lot of regulations that are there for good purpose, but maybe are antiquated because they're localized, right? So maybe there's some opportunity, and I'd love to hear about the practicality of it, of figuring out a framework for licensing globally so that people can help more other people.
Mm-hmm. Yeah, so I think you know, some of us are licensed in multiple states. Like, I've gone through the process to be licensed in like 5 or so states. I have more on the way. But right now, it's a pretty manual process. And actually, a big element of this is like having states make sure you are who you say you are, right? And it's like faxing stuff in, repetitive forms, pictures of diplomas. And so actually, we have a colleague who has a company now that's dedicated to physician identities on the blockchain, and basically building out and raising funds to get it so that a clinician could kind of own their identity, and that what we would need is for states, hospital credentialing boards, insurance panels to buy into using this method to credential, because that would vastly speed up this process.
So wait, if only there was some way to validate that someone owns something and it was them. That
Is that
sounds
an
like
NFT?
crazy talk.
Yeah, her thing is called HPEC, I think,
Yeah.
and it's definitely something a lot of us in this space are interested in and gaining some traction.
Yeah, definitely. I think it's much needed.
I'd love to follow up really quick. What about outside, I mean, just in terms of the practice of mental health treatment, I would think that what you've learned in New York or Texas is 95% the same as other states, as practicing in Italy or in South America or something. I mean, is that true or is that actually not?
So by and large, what I'd say is not all therapy is therapeutic, and not all things that are helpful are care, right? So not all help is going to be medical care. Most of the important things that help us in our lives are not in a doctor or therapist's office.
Yeah.
In fact, 99.999% of the time that I'm in the world, I'm not doing my doctor thing, and yet sometimes I say something that is useful to people, and in some cases life-changing, and the vast majority of things that are helpful and life-changing aren't medical care. And so once we get past, we can't say any words at all if it's not to a person in a state with licensure that's active, we unlock a lot of ability. Crazy and stupid, right. Like most of the things that you need to do aren't surgery, right? We do accept that you need to be in an OR to get surgery unless you're in Florida, where there's recently some awful, I'm sorry. Other folks.
Yeah. I mean, I think that it's not as drastic as like learning to drive on the other side of the road. I think it would be appropriate to have like a little bit of a quiz or primer on each state regarding, there's different rules around like if somebody needs to be emergently hospitalized against their wishes, things like that do vary state to state, and it would be important to know. But that's like a quiz and a couple of like an online learning module. It's not what we have to do now for sure. And I think internationally as well, it's like, okay, the drugs have different trade names, right? But underneath it, they're the same drugs.
Scientifically.
Yeah, some are not approved in every state, in every country, but it's not as gargantuan as it's made out to be.
Yeah.
Another question?
Hi. My wife and I we're nurses in Houston, and we're very interested in
Awesome.
NFTs and mental health and the utility. We're actually doing a mental health nurse practitioner program right now. So my question is, how far down do you see the utility of someone owning an NFT that provides them psychotherapy, or someone owning an NFT that provides them a prescriber that can give them the medication? Like, do you, maybe 5 years, or where do you see that coming about? Because I think utility is...
Within this year, if I have anything to do with it, which I will, is the answer. But that it turns out to be like there was years of work leading up to that being a thing, and tackling some of the questions around who goes to see who, where, when are non-trivial.
Yeah, I mean, I think that, so like in the United States, health insurance is often tied to employment, which doesn't really work with Web3, right? People after their jobs don't do that. So I do think there is a world in which a utility could be providing health insurance coverage. I don't think these would be, NFTs that you could trade. They'd be more like the sole NFT that's tied to your, particular profile. But I do foresee that as a utility, and I know that's one of the things Owen's very interested in.
Yeah, and please after you. Yeah. Oh, just quickly, 40 seconds. I think that people are doing this in different ways now. At least, life coaches are definitely coming in and providing their packages in that way. So I think slowly but surely it's pushing and it's coming through. So we're really excited about the fact that it's regulated in a different way, and again, regulated in a different way, right? So thank you so much, everyone.
Thank you.
Yeah.
We have a sales funnel to let you know about right after this, and a rug puller. Kidding. Thank you so much, everyone, and thank you.
All right, let's give it up for mental health.
Mental health off the
couch.
couch. Embrace your NFTs.